And hello, everyone. Welcome to the third session in our Connected Care in Action series, hosted by Canada Health Infoway and Longwoods. My name is Edwin Chacon, and I'll be your moderator for today. Before we begin, I do want to acknowledge that tomorrow is September 30th, the National Day for Truth and Reconciliation. It's a day to honor survivors of residential schools, their families and communities, and the children who never came home, and to reflect on the ongoing impacts of colonization. For those of us working in healthcare, it's also a reminder that reconciliation must include health equity, ensuring that our systems serve Indigenous peoples with the same respect, access, and quality of care that every Canadian deserves. That commitment begins with listening, respect, and a willingness to do better in the spaces where we work. With that in mind, let's turn to today's discussion on how we can build systems that are more connected, more responsive, and ultimately more human. Our session today is titled Built to Scale, Rethinking Interoperability for Smarter Connected Care. Across Canada, there has already been tremendous progress in digitizing healthcare, from electronic medical records in clinics to hospital systems to patient portals that help people access their own information. And those efforts have made a real difference. And I think everyone here has seen a difference been made through those efforts. But we're still not where we need to be. Too often, clinicians and patients find themselves cut off from a complete picture of care. That's when tests are repeated, information slips through the cracks, and too much time is spent navigating systems instead of focusing on patients. So the big question today is, how do we move from the immense technical progress we've made to actually connecting the technology, the data, and information across the broader health ecosystem? That's the challenge we're here to discuss together. Before we dive in, a quick reminder, please use the Q&A feature to submit your questions. We'll get to as many as we can during the final portion of today's session. So to start, I'd like to introduce our speakers, three leaders who bring different but complementary perspectives to today's conversation. First, Dr. Ed Brown. Ed is a nationally recognized leader in the digital health and virtual care space. Many of you will know him as the founder and longtime CEO of the Ontario Telemedicine Network, one of the largest virtual care networks in the world. Under his leadership, OTM became a model for how technology can connect patients and providers at scale, not just in Ontario, but across Canada and internationally. Today, Ed serves as an advisor at Canada Health Infoway, where he's supporting efforts to build the next generation of connected care infrastructure. He brings a unique perspective. He part physician, part innovator, part system builder, an incredible jack of all trades. He's been deeply involved in shaping the Halo framework and its potential to address Canada's interoperability challenges. Put your hands together for Dr. Ed Brown. Uh, Next, Amanda Gray. Amanda is an experienced IT and enterprise architecture leader with more than 30 years of experience in transformation, now concentrated in the health sector. She's currently with the Provincial Health Services Authority in British Columbia, where she focuses on leveraging technology to improve both patient and provider experiences. What stands out about Amanda is her commitment to inclusivity and transparency. She doesn't just think about systems as technology, but as tools that need to work for the people who use them. In BC, she's been directly engaged in the early Halo pilot work, including the patient summary app that's connecting data between primary care and hospitals. Together, they will help us explore both the national vision and on-the-ground realities of building a more connected health system. Please. Applause. And then finally, Mo Fawal. Mo is the Director of Product Management and Delivery for Virtual Care at Ontario Health. He leads a team of more than 70 technologists, product managers, and architects who design, build, and scale Ontario's digital health solutions. Mo has been deeply involved in initiatives like e-referral, which enables clinicians to create, send, track, and manage patient referrals electronically, and e-consult, which allows providers to seek advice from specialists and other clinicians without requiring an in-person visit. Together, these tools streamline workflows, reduce delays, and improve timely access to care. Mo brings a delivery lens to today's discussion, sharing what it takes to move from pilots to scalable solutions across the province. So, let's start by looking at the challenge. Canada has made enormous progress in digitizing healthcare. I think we all know that. Most clinicians now use an EMR, hospitals have digital systems, and patients are starting to access their own health information. But the truth is, it's still incomplete. Too often, those systems aren't able to exchange crucial health information or even talk to each other. A family doctor may have one EMR, a specialist another, and the hospital another one. And none of them are able to exchange a patient's health information seamlessly. That's when patients end up repeating tests, or providers spend hours logging into multiple portals just to get a full picture of someone's care. And it's not just the EMRs. Even core clinical tasks like prescribing a medication, ordering a test, and sending a referral often happen in separate systems that aren't able to integrate back into the EMR. That means clinicians are constantly shifting between windows, copying and pasting, or even still relying on fax. But digitization doesn't equal connectivity. Interoperability, that's the bread and butter. The ability for systems to talk to each other in real time, securely, and in ways that support clinical workflows is still a missing piece. So Ed, uh, from your perspective, as both a physician and someone who's spent a lot of time in digital health, what does this fragmentation feel like to day to day for clinicians? Can you walk us through the reality of what some are calling portalitis?
Thanks, Edwin. And hi, everybody. Great to be here today. I think probably all of the 106 people watching this call have heard about administrative burden, which is currently weighing down health providers across the country and basically burning them out. Uh, as it turns out, their dysfunctional digital environment, as Edwin has described, is a major, if not the major cause of this stress, right? That's the problem. Physicians have not been subtle about this. So, the last year we had 3 national physician organizations and Infoway in a task force. But at these meetings, they really did not hold back their frustration. They told us pretty clearly that their experience is a mess. Like Edwin has said, they've got many applications which aren't integrated. There's a lot of manual processes, some of which should have been digital. Edwin's mentioned portalitis, which is having to sign into multiple places to get information. And they have less than ideal workflow with limited integration that some that actually block data exchange. Um, to give you a sense of how big this issue is, there was a survey done by the Canadian Medical Association Infoway in 2024, and physicians reported spending an average of 115 minutes per day working on their electronic medical records after their typical workday. Right, so they see their patients and then they sit around for another couple hours trying to finish all the work. This is not just a physician problem, right? I was at a conference last week. I heard Jane Philpott say that there's 235,000 currently on the Government of Ontario's wait list for a primary care provider. And that's just a fraction of the problem. There are literally millions of people across Canada who just can't find a primary care provider. Well, meanwhile, primary care providers are either retiring or just finding another job because it's just wearing them out. The main challenge, as Edwin has said, is that most EMR systems and workflow were not built to any particular standards because there weren't any when they came out. So they're not really ready to accommodate today's needs, which include integration, data sharing with other systems across the health system. But in reality, that's only half the problem because if you look at it from the other side, the rest of the health system is also not helping this problem. And I think you have to think about primary care, which is the best example of this. We recognize it as being the foundation of a high-performing healthcare system, and it's supposed to be the front door to healthcare services, in the community. But that fact is sort of forgotten when digital health, workflow is designed by government product teams or all the other organizations that primary care has to work with, like the hospitals, the pharmacies, the specialists, the imaging facilities, a whole bunch more, because each of those organizations actually provides their own access protocols, their own digital solutions that are mainly designed for their convenience, often not really considering the primary care provider's overall digital environment. So the result, if you're at the other end, if you're the primary care provider or other health provider in the community, is really a chaotic, dizzying array of manual and digital processes that you have to follow, even to organize everyday care. So their experience is, a lot more like a rusty back door, maybe of a haunted mansion, given it's almost Halloween, than it is a front door to the healthcare system.
Hmm. So it seems like this lack of connectivity has caused a lot of problems in a lot of different places throughout the spectrum of work. Amanda, you come at this from the enterprise architecture side. From your vantage point, what are the biggest technical barriers you're facing day to day when it comes to interoperability? And how do those same challenges show up across the broader health system?
Hi, good morning. Thank you for having me. I think, as you heard Ed say, there are numerous organizations involved in delivering care, and numerous organizations that our primary care physicians have to interact with. And as with many of them, we have large and complex health ecosystems. We encounter significant challenges when it comes to legacy systems. So over the years, we've built or procured lots of different systems to do different things within the health ecosystem, and they're unable to communicate with each other. So, or to adopt the standards needed for interoperability. So we have environments that have lots of point-to-point integrations where it's possible, and it's not always possible. And that adds considerable complexity and cost to our health IT infrastructure. And so addressing these issues, especially in the public sector, is expensive, and it diverts resources from other pressing priorities. And of course, we have, especially, currently very limited or constrained funding. So in the absence of having something coordinated or consolidated, organizations are often left to tackle these problems on their own. And that means duplicated work and inconsistent solutions across the sector. Within my jurisdiction, we have several health authorities, and they all have the primary objective of delivering care to our citizens. And the reality is that sometimes they can't wait for us all to get together and try to solve a problem together. So we end up with multiple solutions doing the same thing. They don't necessarily talk to each other, but they need to, because patients don't stay in one part of the province to receive treatment. They receive treatment across health authority boundaries. And if our systems don't talk to each other, that makes it increasingly frustration for the providers, as Ed has talked about, and for the patients themselves, and potentially increases patient risk. So I think as technologists and architects, Edwin, the situation really underscores the need for leadership across the sector. And we need to actively promote the adoption of common standards and solutions. We have to align our efforts. We have to address our shared challenges collectively. And then we can have more potential for meaningful progress. Maybe ultimately we need a national mandate to drive that level of standardization and collaboration. And we need this to overcome these interoperability barriers. We don't want to still create made in BC or made in my jurisdiction solutions. I think we do have the technical means now to overcome these barriers. We need the collaboration across the sector.
100%. Like really, like leadership and collaboration is going to be key to addressing these barriers. And ultimately this lack of connection doesn't just make things more complicated for all of these relevant stakeholders, but also more expensive, right? Mo, from your perspective, what are you hearing from Ontario clinicians and the leaders about the impact of fragmented systems? Where does it manifest systemically, and how does it most commonly affect day-to-day practice?
Hi, Edwin. Thanks for having me. From our perspective, what we're hearing from clinicians is they're very frustrated. Not because there's like a lack of digital tools, but there's too many digital tools. There's lots of digital fragmentation, And none of these tools are really connected into their point of care system. So they have to always go outside of their point of care system to access these tools. And so it leads to a lot of frustration and a lot of that administrative burden that Dr. Brown just mentioned. Systematically, so what happens is you've got all this digital tooling everywhere. We've just created a lot of digital data silos all over the place. And you get one tool for prescribing, one tool for sending e-consults, one tool for e-referrals, another tool for something else. And what happens is all that data is spread across in all these different tools, and not in the primary care EMR. And then ultimately, systematically, it doesn't get to the other points of care where care is delivered at the acute care setting, for example, and that poses a patient safety risk. So if a patient shows up in an acute care setting, we don't have the full picture of what medications they've been prescribed, and potentially that could be maybe a dangerous situation if the patient is incapacitated potentially. Day-to-day basis from clinicians, it's that crushing administrative burden that we've all been talking about. It's a lot of copying and pasting out of their primary care EMR into whatever digital tool they're accessing or launching, be it e-referrals or e-consults. It's a lot of the portals that they have to separately go out into and sign into. So there's a lot of rekeying your logging details and login information. And in Ontario, we have this Patients Before Paperwork program that we're embarking down. And its primary goal is to tackle this large administrative burdens that clinicians have. And we see Halo as one of those key enabling technologies that can help us get there.
Yeah, it's interesting. I think I'm hearing a lot of the same themes from all of the panelists. Digitization was a huge first step, but there's still too many tools that aren't connected. A lot of this causes a big administrative burden. And even though there is digital progress, this digital progress is still happening within these silos. So if we really want to make big progress on interoperability, we have to move beyond simply digitizing care. We need to make the technology work better together. And I think that's where Halo comes in. For folks that might not know, Halo, or the Health Application Lightweight Protocol, is a pan-Canadian standards-based framework designed to connect digital tools more seamlessly into the systems clinicians use every day. It's built on international standards like HL7 Fire, but its real value lies in how it makes those standards practical and usable at scale in real-world care settings. Today, there are more than 50 EMRs in use across Canada. Many of them, like we've mentioned already, were built independently, and as a result, they don't always talk to each other. That leaves clinicians navigating disconnected systems, logging into separate portals, manually entering patient data multiple times, and struggling to make that information flow. Halo changes that. Instead of building custom integrations between each new app and every EMR, Halo provides a build once, deploy many model. Apps can be created using a common interface and then plugged directly into any Halo-enabled EMR. That means no duplicate data entry, no extra logins, and no bouncing between screens. The patient's context flows automatically, and any new information is written directly back into the medical record securely and consistently. For developers and vendors, Halo provides a standardized way to reach more users with less friction. For clinicians, it reduces admin burden and supports more streamlined, team-based care. And for patients, it translates into fewer delays, smoother transitions, and a more connected experience regardless of where they receive care. So in other words, Halo isn't about creating more tools, which I think we all agree we want to avoid, right? It's about connecting the ones we already have and doing it smarter, faster, and in a way that's built for scale across Canada's complex health system. So, Ed, you've seen firsthand what it's like when clinicians are stuck with portalitis. From your perspective, what does Halo do, and why is it important for providers?
Yeah, thanks. That was a great intro to Halo, Edwin. So I'm going to just make sure people kind of get the full picture of what it does. And as you said, it has the potential to really simplify provider workflow, essentially by putting all the applications in one place and integrating them with whatever you happen to be doing with that particular patient at that particular moment. So I have a cartoon I'd like to show everybody just to explain it. I didn't think you were going to watch cartoons today, I bet. But here you go. So remember, this is single sign-on. It seamlessly shares data between EMRs and external sources. It displays all the data and applications in patient context, so you don't have to hunt and peck and look for stuff. It creates an app store. So here's what it looks like. So pretend you're the provider out there. You wake up in the morning, you sign into this on your desk. Next, please.
Here we go.
Can you, there you go. Okay, so you happen to have Polly Smith sitting in front of you in your office today. The thing that's Halo is the thing down the left side. So click to the next one, please. And just to pull that out, that's like a bunch of apps. Okay, so these are the apps that this particular provider has signed up for. And you can see these are sort of typical type of applications that a health professional would use. Next slide, please. You click on one of those. In this case, looks like you clicked on, I think that's e-referral. Next, please. And that pops up in your window. So that red thing, that's not actually in your EMR. That's a window in your EMR, but it's a web-based application. And whatever that referral application is, this is what's showing here. It'll pre-populate it with data in your EMR. It'll pull data from other places. It'll give you the workflow that this app has without having to integrate that with your EMR's workflow necessarily, right? So pretty straightforward. Next slide, please. When you're done, Bob's your uncle, the thing happens, and you go to the next slide and it's all done. I think that's the end. Okay, so hopefully that gives you a good feeling for what this is. I think the other exciting part of this is that you're creating an app store for health professionals, for patients, for anybody. So we're kind of modernizing the healthcare system by putting this stuff in a place where you can actually find it. So the bottom line is this should be quite a bit easier for providers to do and find everything, especially with data interoperability. Vendors should be able to just do it once and with occasional updates after that. It should be way easier and faster and less expensive for provinces and territories to just buy an app and plug that app in, plug and play, make Mo's job and Amanda's jobs a lot easier, we hope. And of course, this should liberate data for patients as well, so they can get their record, which is what everybody wants.
Amazing. Amanda, I'm interested from your vendor and enterprise architecture perspective. One of the big challenges today is that most EMRs require custom integrations for most new tools. From your vantage point, why is Halo, like we just saw, different? How does it make it easier for vendors and health systems to scale solutions?
Yeah, I think, Ed did mention some of the benefits, I think, for vendors. Jurisdiction-specific needs for custom builds do create barriers to adoption, especially for smaller EMR vendors who may not have the resources to support this. I think integrations in these environments can mean high development and conformance costs for each vendor. So in my opinion, Halo creates a level playing field for all participants. It provides an equitable access for everyone, including our vendors, by means of a modern interoperability framework aligned to national standards. So anyone can contribute to and offer the digital capabilities that our healthcare system needs. And this approach ensures that no single organization holds an unfair advantage. It promotes participation across the sector, and vendors can develop their own Halo-based apps once and deploy in multiple jurisdictions. So, over my career, there's always been this elusive goal of portability, and it's been a challenging thing to achieve. I actually think that Halo now gives us something that enables us to create truly portable apps. So it provides that foundational infrastructure, standards needed for us to build and distribute these new tools efficiently. It's a common framework. It's easier for innovative solutions to reach clinicians and our patients. reducing that administrative burden, and most importantly, reducing patient risk, because information is going to be available when and where it needs to be. As you saw in the cartoon, the intent here is to have those apps be part of that workflow within the EMR or the clinical information system, whatever system it happens to be, or within a patient portal. We can use Halo to deliver information to our patients effectively as well. So I see this being quite different. I see it really providing that, as I said, level playing field for everybody to participate and become involved. And I do apologize if you're hearing any crackling noise. I have a puppy that has decided today is not the day that he's going to be quiet and sleep. My apologies.
No, that's okay. I think we're all big fans of puppies here. I do really love how you kind of position Halo as this framework that really creates an equitable level playing field for all participants. Mo, from a regional perspective, why is a framework like Halo important? How does it help provinces move from pilots to something more consistent and scalable?
That's actually a very good question. So in Ontario, we're having difficulty scaling things across the dozens of EMRs that we have in Ontario. So with a standard framework, we've basically laid the groundwork for establishing connectivity between the digital health tools and the EMRs, the dozen or so EMRs that we have in Ontario today. So we can bridge that electronic communication gap with them, and then ultimately reduce the administrative burden that the clinicians are facing. So instead of building separate portals and separate digital tools, and separate deep integrations with EMR vendors, we can break that cycle, leveraging Halo essentially. So rather than having the clinician go out to a separate tool, they can have these tools almost deeply embedded. Feels like deeply embedded. It'll be like a natural extension of their EMR, as we saw in the cartoon that Dr. Brown demonstrated earlier on, with all that capabilities of single sign-on and the ability to flow data back and forth through the digital tools and the primary care EMR. For vendors, right? We've had a lot of discussions with vendors, and we can point to APIs that we have in Ontario for deep integration with the EMR vendors, but then the EMR vendors are like, well, we're not really interested in having point-to-point integrations with jurisdiction-specific APIs. We want to operate at a pan-Canadian level. We have our tools are across Canada. We don't just operate in Ontario, so they don't want to repeat the same integration, 10, 12 different times across Canada. And so Halo allows that, right? So we can have the one framework, or they build towards that one framework, and then the smart on fire applications plug into that framework, so that you can scale across provinces and territories. So from an EMR vendor's perspective, it's one investment for one integration pattern, right? So you've got that done. And then from the digital tool vendor's perspective, they can build one smart on fire app that can plug into multiple jurisdictions, which enables that build once, deploy many model that you mentioned.
So what I'm hearing is like, what we need is definitely a pan-Canadian approach. A pan-Canadian approach is key. And Halo supports that, because it's not really about creating new technology. It's about connecting what already exists. We don't want to create so many different things that are very specific to, and that doesn't support the vendors at all, specific to jurisdictions. And although Halo is very cool, and I know it's something that when I first learned about it, I was really fascinated about the impact it can have. It's not a magic switch. Like anything, it takes collaboration, it takes governance, and really thoughtful expansion. And I think we're starting to see what that looks like in practice in British Columbia. So let's go there next. BC has been one of the first provinces to pilot Halo using patient summary, and the lessons are important nationally. Amanda, you've been leading the patient summary Halo project. In your own words, how is this program making use of Halo, and what have they shown you so far about how a framework like this can support better workflows for clinicians and patients?
Thank you. So we have a patient summary pilot happening in BC with some of our EMR vendor partners. And really what it's shown us is that Halo can be used effectively to enhance the functionality that's available to providers within their EMRs. So by leveraging Halo, information from our public health systems is integrated with data from community physicians, resulting in a comprehensive and standardized patient summary. And this summary is not just limited to clinical use. It can also be made accessible to patients, for example, through patient portals, as I mentioned before. With the Halo launched app for patient summary, our primary care providers can curate and maintain an up-to-date summary of a patient's essential health information. So this can include active problems, current medications, recent encounters. The information can be securely shared with other care settings. So for example, when a patient is referred to a specialist or they're admitted to a hospital, ensuring continuity and accuracy of care. So what we're doing in our pilot is connecting, enabling the patient summary to be transmitted to one of our clinical information systems in one of our regional health authorities, so that if a primary care physician's patient is admitted, they can be notified, and then they can then generate the patient summary from within their EMR, and it gets sent and received by the clinical information system in the health authority, so the admitting hospital. This is right now, as Dr. Brown and Mo and others have said, it's you don't have that information at admission. This enables that continuity of care and the transition of care that that is fragmented and not working well. So we think that the introduction of a consistent digital summary through Halo replaces traditionally ad hoc methods. So the paper printouts, the fax narrative letters, the phone calls. This improves transitions of care by providing a reliable and standardized approach to information sharing. So it lays the groundwork for digitization and routine sharing of discharge summaries as well. So, Halo enables our providers to access vital information more quickly, directly within their workflow, supporting efficient and informed clinical decision-making. And even as important benefit is it eliminates the onus on patients to have to repeat their medical history in every encounter and potentially undergo duplicate tests. And if they're being admitted to emergency, they may not be in a position, in a condition to actually convey to the doctor what's happening to them. So we really think that this demonstrates the value and promise of Halo, and we hopefully can expand that.
So it sounds like one of Halo's key strengths is the ability to integrate directly and quickly into existing clinical workflows. Amanda, from your perspective, how does that kind of integration reduce technical friction for health system teams? And more broadly, how does this type of infrastructure support BC's health system future goals?
Sure. So we know that across the country, not just in BC, providers, that's clinicians, medical office assistants, others supporting those workflows, work with lots of siloed systems. In BC, we have a very diverse, fragmented ecosystem, and they spend a significant amount of time doing manual workarounds, as I said, fax, phoning, printing to PDF, to obtain patient information that exists outside their local systems. And this wastes time, it delays care, and increases the risk of error. No matter how diligent they try to be, they're trying to do all of this and care for the patient at the same time. And we've heard directly from our care teams. I'm not at liberty to say, who they are, obviously, but across the board, it creates friction between them. There's a high degree of stress. They need the information right away. They can't get it. They're trying to coordinate care for the same patient. And obviously that it negatively impacts their operational efficiency, and it complicates the care planning for that patient. So If we can close that loop for them through improved data sharing, making sure they have access to the information when they need it, and reducing or eliminating those manual workarounds, they can spend that time focusing on care delivery. We lower the frustration, we lower the stress, we increase their trust in the quality of the information and in the health system in general. And I think the adoption of Pan-Canadian and these widely accepted interoperability standards and Halo can deliver on our objectives of a connected health system. We need to get the right information to the right people at the right time. I think we should always be focused on doing what's needed to improve access to care, improving the quality of that care, and reducing harm.
It's great, and it's great to see such progress happening in BC. Mo, based on these early Halo results in BC, what do you think they reveal about the potential to improve health system efficiency and clinical workflows nationwide? And how might those insights guide other provinces and territories as they move toward a similar framework?
Yeah, the early success that they've had with the patient summary pilot, it kind of proves to us that there's a willingness from ER vendors to engage on a standardized approach of extracting data and sharing data, right? So this is something that we haven't had in the past. And with that confidence, we know that we can then build upon this and scale this across the rest of Canada. So we can take these reusable components that have been built from BC's pilot, for example, and scale it in other jurisdictions in Ontario, in Alberta, Saskatchewan, etc. Right, and the important part is the cognitive burden that Amanda was talking about, the frustration, the stress, etc. All that additional clinical workflow and manual tasks and faxing and printing to PDF that Amanda's mentioned, right? We can eliminate all of those things with an appropriate standard for basically exchange of data and sharing of the data. And we can build these tools and give the clinicians back time to focus on patients rather than all of these administrative burdenous tasks.
Mm-hmm. It's great to see, we're doing great work in BC, but let's shift east to Ontario, where the province's journey towards a connected health system is gaining momentum around two cornerstone solutions, e-consult and e-referral. So these solutions create a coordinated pathway for care. With e-consult, primary care providers can get rapid specialist input without sending the patient to another appointment. And when a referral is needed, e-referral ensures it moves digitally and transparently through the system. Both reduce delays and help patients move more smoothly throughout the system. Ontario is steadily building the architecture for a province-wide referral and consultation network, and Halo is an important enabler of that vision. Instead of custom building separate interfaces for every EMR, Halo provides a reusable, standards-based framework that lets solutions like e-consult and e-referral integrate directly into existing clinical systems. Mo, as someone leading digital integration efforts on Ontario Health, how do you see e-consult and e-referral changing the way clinicians and patients experience care?
Yeah, so from a clinician's perspective, we are looking to basically scale out e-referrals in the province. We've had some limited success with e-referrals in the province of Ontario, but we're trying to scale it out at a more faster basis and a broad basis, so that we can axe to facts, as we used to initially say, instead of papers before paperwork, patients before paperwork. And basically, what we really want to do is basically take this opaque process where you send something out and you're not entirely sure where you are in the process, to a transparent and trackable one. So we're looking at also additionally standardizing the forms for e-referral in Ontario. So instead of having customized forms all over the place and, lots of portals also all over the place to submit your referral, we're having a standardized approach, standardized forms, so with one single point of entry for actually sending out your referrals. And so from a clinician perspective, there'll be a standardized form with one way to access it. And to be able to send your referral. That way you'll save time and administrative effort from figuring out, how do I send this referral out in Ontario? You won't have to spend time chasing also the referrals around and getting their, the status of the referral, since everything will be digitized instead. So rather than phoning and figuring out, hey, has this referral been accepted? Or how do I get back to my patient? You won't have to do that work anymore. It'll all be automated notifications. From a patient experience perspective, it's really frustrating, right? There's no visibility in the process. You send out a referral, you ask your doctor, you meet your doctor, you're worried about something, the doctor sends out a referral, and then you wait. And it feels like almost of a black hole, right? In the old way, you fax things around, and you're not entirely sure if the fax has reached its destination. These things sometimes tend to be lost or misplaced, and I've even experienced that myself firsthand too. I'm sure lots of other people on the call here have as well. And with e-referrals, you can eliminate that. You can eliminate that frustration. You would eliminate the delays involved in all of these lost transmissions, and speed up the access to care from a patient perspective. So you don't have to be as a patient worried about if your fax reached the specialist that it needs to reach to at the end of the day. You can just be focused on the things that you need to care about your family.
It's great that this work is eliminating a lot of these common frictions that we see in the system. How do you see Halo enabling that broader pathway, moving from individual successes to a fully connected referral and consultation network?
Yeah, so basically what we're planning to do is try to scale this out. So this was the problem in the past, scaling. So we've had some limited success in integrating referrals, for example, and e-consults into the primary care EMR. But the biggest problem that we have is essentially scaling that out. We have about a dozen or so EMRs in the province of Ontario, and they have had individual, unique, custom integrations for e-referral and different integrations for e-consult. And in Ontario, we do also have the contextual management system, which is part of our certified EMR standards that we work on with OMD. But it includes things like single sign-on and patient and provider context. But what's really missing is the data about the patient that you need as part of the e-referral or the e-consult. So even though technically a lot of the systems are partially connected, it's not good enough from a clinician's perspective. You need to still go back into your EMR and copy and paste some of the data. And some of the integrations are not standard, so they're not all scaled across all the EMR systems. So that's one of the challenges we have in scaling in Ontario. So how Halo changes this is, instead of taking this traditional approach where you approach every individual EMR vendor with every individual product and ask them to integrate this into their product and make this a better experience for their patients. Instead, we have a plug and play adapter back, from the 2000s when plug and play was a thing with computers. You basically can then take your applications, e-referral, and plug and play it into Halo. It shows up in that toolbar that Dr. Brown demonstrated initially. So the key is not just single sign-on and not just exchange of patient context and provider context, which is just the basic demographics about the patient and the provider, but also the data that goes along with them, which is really important, which can really enable the clinical workflows, right? We can enable a lot of digital tooling, not just e-referral and e-consult, with this approach.
Yeah, it really sounds like Halo can be this interoperable backbone support across systems across the country. How might that kind of backbone support or interoperable backbone support Ontario Health's broader vision for a connected patient-centered system over the next 5 or even 10 years?
That's a good question. I think we have, if we are seeing the trajectory right with Halo, I think we have a lot of things that Halo can be very transformative for us. So, I mean, the main thing is we don't have to solve the integration problem anymore, since that will be solved. We don't have to go back and approach every single EMR for an integration approach in Ontario or in other jurisdictions. That will be solved. We won't have to worry about that problem. We'll be able to scale all these applications really rapidly, right? And one of the things that we also have in the back of our mind is we have another another program. I'm not sure if most of the folks on the call here are familiar with it. It's called Evidence to Practice. And it's a provincial initiative that allows basically for integrating the latest medical research and best practices in clinicians' daily workflow within their EMR. So for they're targeting clinical areas like diabetes, COPD, CHF. And their approach is basically to deeply integrate these tools within the EMR. And again, the problem for deeply integrating within the EMR is you've done it one way for one clinical area. Now you need to do it again for another clinical area, and again for another clinical area with that one EMR. So all of a sudden, if you're tackling 10 clinical areas within the EMR for just the E2P program, you've got 10 custom integrations with one vendor. And guess what? We have a dozen vendors. 10 becomes 120. And then, evidence to practice is a pretty interesting program, and it can serve as a benefit to other jurisdictions as well. So going from 120 now to other provinces and jurisdictions that may have different approaches is going to be extremely difficult and very time consuming and expensive to scale out. So without having that deep integration problem anymore, Halo helps us solve that problem. We can really create one app per, let's say, clinical area that can easily plug in and play into the EMRs across Ontario. So if somebody develops something very useful in one jurisdiction, you can then take that and scale it out to other jurisdictions across the rest of Canada. And of course, there'll probably be some kind of governance process about what gets plugged into what jurisdiction. And I'm sure that'll be a small hurdle that we have to get past. But that's a different type of problem. The problem for technology and integration and scaling, that barrier will be removed. So we'll really basically enable the innovators to build smart and fire apps in Ontario. And basically, we'll be able to build a true marketplace for innovation in Ontario. So I think that'll allow the marketplace to develop all kinds of interesting apps, things for patients to communicate with their providers. I mean, there are some tools out there, but I think they're really fragmented, and only a handful of providers provide these things. But you can make one, and you can plug it into all the EMRs. Maybe there's tools for viewing your health information all of a sudden that could be available, or even contributing your own data into your own healthcare information. Of course, we need, we can empower the patients through Halo, and I think it's to me at least, 5 to 10 years looks like a bright future.
It's exciting to see like the future, the vision that we'll be able to be in the next 5 to 10 years. And I'm actually quite surprised. We've really flown by this conversation today. It really is, when you're talking about interoperability, time goes by just like that, right? And I'm glad to see that these local successes point to the future where these tools are seamlessly integrated and scalable across systems and aligned to the needs of both clinicians and patients. So we see, moving on to our final section of today's conversation, we see that each of these examples highlight a core theme. When tools are integrated into the EMR and supported by a common framework, they become easier to use, easier to scale, and ultimately deliver more value for patients and clinicians. Halo provides us with a consistent framework so provinces and vendors don't have to reinvent the wheel. It's flexible enough to support local priorities, which I think is key, but consistent enough to build national momentum. Ed, where do you see Halo heading next? What's the path to scaling this framework across provinces?
Yeah, actually, listening to Mo, I want to rename this session. We could call it Plug and Play 2026. Because that's the goal. So, I mean, what you've seen today is, BC and Ontario, have drunk the Kool-Aid, I think, and they've been tremendous leaders, sharing the vision and actually making stuff happen, which is wonderful. We've also, as a nation, actually checked some pretty big boxes, right? So the technology ideas are now actually out there. They're being tested. They've been proven. We also have an official national standard, which is in the place where official national standards get shaped, modified, and updated over time. So that's a big step forward. Ontario is actually busy building what we call a reference architecture, which is code that we hope actually could be leveraged by other provinces if they're ready to implement this. Actually, Mo mentioned a really important point, which is just how exciting it is if we can get kind of an app, app stores or app store happening across the country that providers and patients can use, right? Which could set off a wave of innovation. Think of what you could do with, agentic AI and all kinds of other stuff if you could access it easily. So it's very exciting. So I think for next steps, I mean, there are other provinces that are interested. We want them to dive in soon. We hope they will. One of the big, probably the biggest challenge is the EMR vendors, right? Because there's a lot of them and they have to do some work to get here. And they have to figure out their business model, like why would they do it and how would they do it? We think we're hoping that there may be some legislation coming back at a federal level, which we think would obviously accelerate this pretty quickly. So that's kind of what I'm hoping the future will bring, but I think the future is bright. We just have to have something like this. We can't continue having, more than 50 EMRs that are totally disconnected or take huge resources to connect to the rest of the healthcare system, because all the providers in the community are cut off. They basically can't connect with the rest of the world.
It's really interesting to hear you talk about the future, and I appreciate that perspective. For Mo and Amanda, as we look to the future of Canada's health system, what do you guys think in 60 seconds or less? We're running out of time here. What will it take to generate national momentum for Halo so it can grow from promising local successes across the country into a truly pan-Canadian standard? Maybe we'll go to Amanda first.
Thanks. I think what we need to do is continue to showcase the progress that we're making and the successes that we're able to demonstrate with Halo on the ground, and show the true value in practice, connecting our community physicians with our public health systems and showing that, together we can improve the provider's experience and the patient's experience. I think it's important to note technology and specs like Halo are parts of the solution. They help us see what's possible, but everyone involved in care delivery and its oversight, programs, policies need to be aligned and committed for this to work. And so to echo, Ed's comments, we need a national driving force. We can't fix inefficient workflow or policy that prevents data sharing with technology, but at least we can reduce the technology related barriers. And as I said, showcase what we've done.
Great. Now, Mo?
Yeah, we're starting to see it, right? Basically showcase the initial successes and use it to basically scale out all these efforts that we're working on, such as e-referral and e-consult. We have big plans for e-referral and scaling it out using Halo, but showcasing how that can work and enabling that within Ontario, and then we can scale that exact same methodology out to all the other provinces and territories. Just the ability to do this fast and cost effectively, basically, is one of the key things that we should showcase about the Halo framework, and makes it also exponentially easier to cross jurisdictions as well, right? So we have all these provinces and territories, get them all on the Halo framework. Start talking about it at a national level. We already have discussions with other provinces and territories about this, and a single unified approach also for the EMR vendors, which I think they're also pretty excited about in Halo. We've had a few conversations in Ontario about them.
Great. No, thank you. And let's, in the few minutes that we have left, I do want to spend some time getting some attendees' voices, some questions. We've had a lot of great questions coming in through the chat. And although we can't answer every question, I'd like to prioritize, some that were asked most frequently. So, Ed, for you, in a few sentences, we don't got too much time left, but in a few sentences, what's the elevator explainer for how Halo works? Does the clinician use Halo as the main interface rather than the EMR? Or does Halo create a single login for multiple vendors? Does Halo only support certain approved apps or any? What would you say?
That's a longer than one sentence question, Edwin. But basically, I think I'll go with Mo's mantra, right? It's plug and play. So if you're a vendor, if you're a province, if you happen to have a point of care solution, the thing just plugs in and integrates with your solution and makes life simple for you.
Great. Now, next, Maybe we'll start with Amanda. What is the respective role between national government, provincial government, and private sector to get this moving and prioritize Halo? Amanda?
That's a great question. And I'm not sure that I have as good an answer to complement the question. So from my, in speaking for myself, I think we're at that point now where we need a national mandate. It needs to be driven, I guess, federally, and our jurisdictions need to come on board. Care needs to be delivered locally. You need to give jurisdictions the flexibility and ability to do what they need to do so effectively. But they can't solve this problem on their own. And we've created our siloed systems on our own. So we need to work together, federal and provincial territorial governments, to agree on adopting Halo and moving forward, and not creating these siloed systems, not creating our own standards for the same thing. And I think we should be focused on governance, conformance, making sure that the policies are in place to enable data share. We've removed the barriers to data sharing, and encourage the private sector, who typically have the means to be innovative, to do what they do well. And as I said before, provide them with that equitable, level playing field in which to do so, and collaborate together. Because at the end of the day, it's our patients and our providers that we should be focused on, not whether or not we happen to agree with a particular standard or regulation. We need to get past that and work together. This is a national healthcare system. We should be approaching it on that footing.
Well, and what a best way to end it. Thank you so much, Amanda. And thank you, Ed and Mo, for such a thoughtful and forward-looking conversation today. And thank you to everyone who's had the chance to join us today, ask questions, and contributed to this dialogue. Big round of applause to everyone and everything that happened during the discussion. It's exciting to hear that interoperability is really the foundation for smarter connected care. And Halo is one example of how we can rethink digital infrastructure, allowing clinicians to spend less time navigating these systems and focusing more on the patient, focusing more on seamless, personalized care. Fortunately, the conversation doesn't end here today, folks. Infoway's partnership conference is coming up on November 17th and 18th in Quebec City. It's one of the premier gatherings on digital health in Canada, bringing together clinicians, policymakers, innovators, and system leaders. Today's themes: interoperability, connected care, Halo, and scaling innovation will be front and center at the conference. We encourage you to join us and continue this national dialogue, and we'll drop the registration link in the chat for you to look. On behalf of Canada Health Infoway and Longwoods, thank you for being part of today's Connected Care in Action session. We hope you'll join us for our next webinar at the end of October, where we'll discuss how public-private collaboration drives system change. Until then, take care, and thank you again.